Namaste. Myself, Dr. Samya Vianapat. I'm a chief consultant at Diabetes Reversal Clinic, Bangalore. So I'm over here today to talk on the topic, what do we do in our diabetes reversal program? So what exactly or how is this process goes and whatever it includes. So many patients were asking, like I have done many videos on many topics related to diabetes, could be from the diabetes basic definition till the complications of the new types and what are the major my videos is on diet and how they are working with the type 2 diabetes. And is there a possibility of reducing the insulin dosage in type 1? So there are many topics I have covered. So my patients were also curious and they want to know why can someone meet us and who all the reversal is possible. Definitely, I won't say everybody with the diabetes can completely get their disease reversed. So who all are having a chance of getting it done should, like you can filter yourself, then later you can meet us or you can ask for the guidance, however you want. The first thing is, if you're a type 2 diabetes, then the reversal is possible. So what are the major filtering or major filtration to get you under that particular program is? You should be below the age of 60 years. Second thing is, you have not started with any kind of complications, diabetic complications. Majorly should not be including your kidney. Or you have not started with any kind of retinopathy, retinopathy issues, like you have already started with a blurred vision. And if you have a uncontrolled sugar level is also okay. If you are losing sugar in your urine after 5 years or 10 years of diabetic life is also okay. We can still get you under the reversal program. But if you are below 60 years and you have not started with the complications. So this is the basic filtration. If you feel like you're below that, if you're able to fulfill this two basic criteria, then you can come and meet me for the consultation. So what exactly happens in consultation? Why do I have to meet you? The first thing I have to understand, how was your history of diabetes? Like when did you got diagnosed and how did you got diagnosed helps me a lot to understand about your working. Was that any symptoms or all these symptoms started subsiding or getting suppressed once you started with any dietary changes or lifestyle changes, which would include a diet and exercise, or you already started with any kind of diabetic medications and that you started controlling all your sugar levels. So I need to know whether you were a patient of diabetes, you were a classical patient, like you started with symptoms and then your blood sugar level started rising. But most of the patients, whoever we meet, will always come to us with the reports and they are very confident that doctor, I'm absolutely doing good. Only my reports are abnormal. So definitely if your reports are abnormal, your body is undergoing something or it is in a stage of hidden symptoms or diabetic, pre-diabetic stage. But it's not mandatory. Like for example, you have got your FBS up to 160, 170. And I can't tell you that you're pre-diabetic just because you don't have a single dose. You are diabetic or there is a chance that you're not able to analyze your symptoms. Because nowadays the diabetes symptoms have really changed from, for example, the major gastric symptoms was increased hunger, increased urination. Nowadays, the people who won't stop drinking water, they feel like having 3 to 4 liters of water per day is very normal. And more the water you drink, the more the healthy you are. This is the concept which is spread post-corona. I would say people are becoming so much of health conscious. They just keep drinking water. See, it's definitely whatever you drink is okay, but your kidney cannot just let it go without filtering. Please understand, your kidney is under pressure. That also you might have increased urination. And the second thing is hunger, because nobody would be able to appreciate what is the difference between appetite, hunger and just feeding on time. It's like 8-1-8. Yes, Dr. And in between I do take a 2 snacks break. So the basically you're missing up your observation of that particular symptoms. So this is what I want to understand in the consultation. One is how was your, what is the history, and do you have any family hereditary? And I'll be able to understand. This makes me to get a clarity whether you have come up with, your insulin secretion has reduced, or you are really suffering from a insulin, your cells are suffering from insulin resistance. That gets me an idea. I should work more on your diet, exercise, or do you really need a real medication? Or I should also understand this diabetes is not the only culprit in your body. This sugar levels are increasing because you are obese, or you have some cholesterol issues. You're also suffering from thyroid, or you're also suffering from any kind of anxiety issues. That is something which is related to your stress hormones, which is indirectly affecting your insulin because insulin is also a hormone. So there's a major factor I have to understand. These are all the things gets me an understanding how much I'd be able to help. The next step is to understand whether do you need an external therapy. So external therapy is not mandatory for everyone, and yes, if it is only a pure case of diabetes and doesn't have any other associated diseases, then sometimes I'll start only with the strict diet exercise. Diet exercise is very much compulsory for everyone. So then I decide whether I should put you on a basic treatment. So that would include only a few, 1 or 2 times before publication, which you had to freshly prepare it for along with this diet and exercise. Or maybe some more medications, the advanced communication, where it requires mere rejuvenation of few organs in your body, which could control the particular dosha which is increased in your body. I should understand whether it was such a pitta-brahmika, kapha-brahmika, that how bad is the chronicity. So depending on that, the medication will be customized. So the next question comes is, the patients are concerned, like, doctor, if I have to come down to your center, if I have to take some external therapy, yes, initially, if you're really obese, then I have to work on, and your cholesterol levels are very bad, but definitely you need few external therapies. You might have to spend 1.5 to 2 hours at my center. At least 1.5 hours, maybe from 7 to 10 days is the duration I say. And I might repeat it after 3 months. So within the first 3 months of treatment, generally my treatment programs goes 3 or 6 months. Like every 3 months it changes. And the target for this, before that I have to give a clarity. Like if you don't feel a lot in bio, then for some patients who really needs that particular therapy, then I do give them a formulation of medicines. We send it. They have to get it done anywhere via any Ayurveda center. But if it is really that necessary, if not, I'll just support them with the internal medication along with the diet and exercise, and then we work on reversal program. But that might take a 1 month extra. If we are working along with extra therapy, the results will be more faster. So definitely this treatment program can be taken up from whoever is located outside Bangalore as well. So the next question is, doctor, what are the results I can expect in reverse? See, the first thing you have to understand, there is 2 category of people: only tablet dependent, tablets and insulin dependent, only insulin dependent, no medicine dependency. So no medicine dependency, I would say within 6 months, really afterward, the major goal is to make their A1C level below 6 and make it completely a normal reports with the diet and exercises. And they will be a standard final customized diet with which they have to live in with forever. This is for the non-medication. The other category people, the medication, tablets, insulin, so that depends from varies from an individual depending on the dose of the insulin dependency, depending on the tablets dependency. If you are taking medication only with for an example, is only metformin, or someone with the gibberellin combination, some have already gone with any kind of blood thinners, or maybe a cardiac supporters, maybe your aspirin, ecosprin, you have already started. Some have already started with the cholesterol medications. So depending on that, I have to decide how much time it will take. And Sometimes the BP medication, if you have started for more than 2 to 5 years, then you will not be able to stop because it has already created dependency in your body. So depending on that, I'll be able to tell you what type of reversal is possible, how much medication I can stop. If you have only a tablet dependence related to diabetes, that yes, that we can gradually withdraw the medicines and that work on only with the diet and exercise. But everyone whoever wants to come into this program, please understand, you will be put on a particular diet or exercises throughout your life, be one or the other standard customized way. For example, you might be having paneer every day, but I might give you a diet where you can have paneer weekly once, and that is set for your lifetime. The people who have that disciplined commitment lifestyle and who are really able to do that, they are always can reverse their diabetes. That possibility is definitely there. But if you come to me, doctor, I have a people who have quite affordability, but they don't have time or commitment to follow it. Then also, it is not going ahead. So this is what briefs about our diabetes reversal treatment program, what we do at our clinic. So if you have any more queries or anything, if you're really confused, you can also take up a consultation. It's not necessary. At least you'll understand at what stage you are and what are the possibilities. And if you don't do it, where you could be after in the next 5 years. I would be able to tell you where you could reach. And if I feel it's not necessary, if you're in a pre-diabetic condition, then definitely I'll not put you on medication. It is only a reversal possibility with your diet and exercise. That is also possible. So this is our diabetes reversal treatment program. Thank you.